Thank you so much for joining me. I see you have some items here, and the coronavirus is all over. It's on social media as well as the web. Let's talk about it. What is the coronavirus?
Yes, sir. Well, first of all, thank you all so much. Thank you, Marcus. Thank you, WJTV, for having me. So what is the coronavirus? And like you said, it's everywhere, and people are asking about it.
Yes.
As a physician, most of my patients are asking about it. The coronavirus is part of a large group of viruses that causes illnesses in humans as well as in animals. And it's been around for quite some time. So a subtype of coronavirus is actually the common cold, which if most of us have lived long enough, we will have an actual cold. I'm actually recovering from one right now. But it also can cause more severe diseases, such as SARS, which is severe acute respiratory distress syndrome, which can be very, very serious, and it also can be fatal. Now, everyone is hearing about the coronavirus now because of the recent outbreak in China. And that's responsible for the most recent type or subtype called the coronavirus 19. So specifically, coronavirus is part of a large group of families. At the same time, what is scaring everyone right now is the COVID-19. It initially presented itself in December 2019, and WHO, which is the World Health Organization, this month earlier went ahead and classified it as something that was serious, a pandemic, and it looks like it's possibly about to continue to get worse.
And like you said, it's pretty big. It's everywhere as far as the publicity of it.
Right.
What can people do to stay away from it or to not catch it, so to speak?
Well, the first thing that most people, I hope by now, are hearing about it is if you are traveling, you definitely want to avoid going to China. You definitely want to avoid contact with anybody who has been to China. You want to avoid areas where people have had a widespread outbreak. So I know there are some other countries in addition to China where people have been found to have the condition. I'm also hearing that in California, there's over about 8,000 people that are being monitored right now. And it's thought that one person actually has been diagnosed with the disease already. So what you hear a lot of people saying is, it's not a matter of if the coronavirus will spread here to the United States, it's a matter of when. So.
And that's, I guess that's kind of scary for people because, again, when you said when, nobody knows
right.
when, but you just have to keep yourself protected. What's some precautionary measures that people can take?
So that's a good question. So in the event that someone has been around someone that has thought to have contracted the coronavirus, actually similar precautions are precautions that you would take for someone who may have had the flu, or someone who's had, another type of condition that's contagious, as far as washing your hands frequently with warm soap and water. If you're not able to wash your hands frequently with warm soap and water, also using a hand sanitizer, which I have here, which is responsible for killing 99.9% of the germs. If you have a family member or a loved one who, has symptoms of the coronavirus, and we can talk about those next, you want to make sure that you're disinfecting any areas that they've been around, and you're doing that quite frequently. There's also the mask that someone who has symptoms would need to wear, and make sure that specific things are done as far as before even using the mask, making sure that there's no holes in the mask anywhere. Wearing a mask because it can be spread through droplet precaution. So coughing is one way that it can be spread. It also can be spread actually through talking, through exhaling. So it's very important to make sure that you limit your contact within 3 feet of someone who's been sick or been ill. After the mask comes off, definitely making sure that it's closed and discarded immediately, and that the surface on the inside does not, get laid down or, anything like that. So the symptoms, basically don't necessarily differ from someone who's had a common cold or someone who we may think had a flu. You can have cough, you can have fever, you can have chills, you can have body aches, you can have nausea, you can have sore throat.
So it's very similar.
Very similar.
Can you get the flu shot to protect yourself from it?
You cannot get the flu shot to protect yourself from coronavirus. That's a very good question. Although currently the CDC is trying to work on developing a vaccine now, And even if they are able to get a vaccine, it may take several months, maybe even years, in order for them to get it. So right now, there's not a particular agent that you can get out there to prevent it. This is also a very important question. Do antibiotics kill coronavirus? Do they help? They don't. Antibiotics kill bacteria, not viruses. So for the listening audience who's hearing this and wondering, okay, if I do get it, what can be done about it? Really just supportive care. And what is supportive care? Making sure that you stay at home. If you have kids, make sure they stay away from school. Make sure that you're avoiding any contacts with anyone else, making sure you're getting plenty of rest, making sure you're drinking plenty of water, making sure you're getting your vitamins. All those things make a big difference in your body's ability to respond.
And like you said, just making sure you have those checkups on the regular. So if they don't have a doctor, where can they find Dr. Turner? Well,
they can find Dr. Turner at 2135 Henry Hill Drive at Turner Care over off Highway 18. Now we do only treat patients from age 16 and above, so that does exclude the pediatric population. But fortunately in Mississippi, we don't really have a shortage of a lot of doctors, or at least not here in the greater Jackson area. I do want to add that everyone who contracts the coronavirus doesn't die from it, all right? More than 80% of people who get it recover and do just fine, all right? So it's only about 1 out of 6 that actually gets serious symptoms. And only about 2% have died so far. So there's 2 out of 100. There's 2 out of 1,000. There's 200 out of 10,000. I think that's very important because, it's understandable to be scared because you're hearing about so many people who have passed away. At the same time, most people who get the condition do fairly well. Now, in the event that you get it, don't just stay at home and be like, I'm not going to the doctor. Go ahead and call your doctor. Go ahead and, get to the hospital if you need and make sure that it's not more serious than you think it is.
Perfect. Well, thank you so much, Dr. Turner.
Yes, sir. Yes, sir. Well, thank you so much for having me, and thank you all for all you do.